one of the important topics for your NEET PG exams or INACT exams would be sterilization and disinfection. Sterilization on one side, disinfection on the other side. Now, though both will tell you that you're trying to get rid of dangerous organisms, you have to be more specific about what each of the word means. You might have learnt it many times before, but remember, sterilization means removal of all possible microbes. All possible microbes, be it pathogenic or non-pathogenic, doesn't matter. Be it a live organism or a vegetative structure, doesn't matter. For example, spores or bacterium, whatever it is, bacterium is actively multiplying stage, while spore is a redundant and dormant stage. All of them should be removed. But when I use the word disinfection, this is for removing organisms who are capable of causing diseases. Removing microbes who can cause disease. So we are not concerned about the non-pathogenic organisms capable of staying there. If spores are present, it doesn't matter because spores directly does not cause infection. But the spores, when they go into the host and inside the host, if the spores are facing a favorable atmosphere, then they can cause diseases. But that does not count for disinfection. Now, this will also be compared with another word called as antisepsis. Antisepsis. Here, you are preventing infection in a local area. Preventing infection in a local area. This is happening in vivo, that is on the surface of the human host cells, which can happen on wounds, on tissues. Antisepsis can be acquired whenever you will be able to perform this on the human being when there is wound or there is a kind of loss in the integrity of the epithelium in case of your skin or tissues. Remember, there is one other word which can confuse you for your exams. There's something called as decontamination. Decontamination is a word that you use not only for microbes. For example, if you're walking into a containment zone, radiologically hazardous zone, the radiation also can be attacking human beings. So that also should be removed from the equation. That will be called as decontamination, where it can be microbial removal, chemical removal, radioactive removal, or any other kind of hazards. Now them should be removed from the equation. That would be called as decontamination. We'll not discuss decontamination much. So let us look at the possible ways by which we can achieve either sterilization or disinfection. You can have physical methods on one side. We can have chemical methods. We can also have radioactive methods. When I use the word physical method, heat comes into picture, pressure comes into picture, pH also comes into picture. But if that pH alteration is done by any kind of acid or base, then it can be a part of chemical methods also. So alteration of pH that can render an organism less dangerous or non-viable can come under both physical methods and chemical methods. Well, radioactive methods would mean to say that I can use radiation. For example, in the period of corona, whenever you go to a major theater, for example, a movie theater, they'll be using UV sterilized seats, UV sterilized containers for food. So UV sterilized is a method to understand that UV light can be helpful for killing an organism or a microbe. Gamma radiation also can be used for killing a microbe. So this is about radioactive methods. So we have physical methods, chemical methods, and radioactive methods which can help us achieve either sterilization or disinfection. Now when it comes to sterilization per se, we can have your heat, which can be either moist or it can be dry. At the same time, you can have beta, gamma radiation, which can help in sterilization. We can also go for filtration. What is filtration? It's a type of physical method. For example, you have a mixture of microbes. For example, a microbe is 100 nanometer in size. Another microbe is 200 nanometer in size. Another microbe is 300 nanometer in size. Another microbe is 50 nanometer in size. So if I want to differentiate this 50 nanometer from all the other areas, say for example, I have a filter whose sieve diameter is 75 nanometers. It can allow the exit of 50 nanometers, but all the others can be retained. If I want to separate this from this, then I can set up a size of 150 nanometers, which can separate 150 on the other side, 200 on the other side. Likewise, I can keep on separating organisms based on their size and using the alteration of pore size as the mechanism. In case of sieve filters, biological filters can be used as physical methods. Ultimately, you can have something called as plasma sterilization. What is plasma sterilization? Using the fourth state of matter called as plasma. What is plasma? A highly ionized state of any substance, matter. Highly ionized state of matter. The ionization can hit through the organisms and can destroy the biological membranes. So all these are the four methods used in case of sterilization. So heat, beta gamma radiation, filtration, and plasma sterilization. Four major methods. Now that will bring us to the question, how can I deal with disinfection per se? Disinfection also can use the word heat, which can be either moist or dry. But here I'll be using UV radiation and I'll be going for boiling and sterilization. In heat, you'll be having boiling based pasteurization. Now, when you learned about pasteurization, it was introduced by Louis Pasteur, obviously, and this pasteurization was helpful in two forms. One was Holder method, the other one was flash method. Remember one golden rule. Whenever you are trying to expose a particular biological fluid, for example, milk, to heat, if I increase the heat by even mere number of degrees of Celsius, the amount of time or contact time required is dramatically decreasing. For example, if I'm going to use 60 degrees Celsius heat, I may require to boil it at 60 degrees Celsius for 30 minutes. But if I increase the temperature to 72 degrees Celsius, then I can do it in a matter of seconds. So I repeat, when the temperature increases, then the amount of duration of contact time decreases dramatically, exponentially. So this can be applied in case of flash method. In flash method, you have very high temperature just for seconds. In Holder method, you use moderately high temperature for minutes. These two are the types of pasteurization you come across. Now, they can ask you questions about the chemical agents used. The chemical agents most commonly used can be ethylene oxide, referred to as ETO, ET2O, even in case of exams. So if you see this word, please don't be panicky. It is just ethylene oxide. And you can have formaldehyde. Apart from that, you can have glutaraldehyde. Remember, glutaraldehyde is more effective than that of formaldehyde. Generally, we can use alcohol. Now, when you think about alcohol rubs in case of COVID era, you can have alcohol rubs which may be containing 70% ethanol, and also you will be having isopropyl alcohol. Please remember, here I'm using two types of alcohols in combination, so the concentration of ethanol needed can be as low as 70%. But if I'm not going to use isopropyl alcohol, then ethanol concentration should be more than 80% to deal with the situation. So the more the number of combination I give, the lesser the amount of requirements for each of the subunits. You can use aldehydes like glutaraldehyde, formaldehyde. You can also use phenol. Phenol is nothing but the source of carbolic acid. Remember, if this is a benzene ring, and in the benzene ring, if OH is directly attached to the ring, that is called as phenol. Now, some people have raised questions. What is the difference between phenol and benzyl alcohol? In the benzene ring, if I bring in a methane, and to that methyl group, if I add a OH, this is called as benzyl alcohol. Benzyl alcohol has properties of alcohol, while phenol has properties of phenol, which is corrosive and unlike that of alcohol. And this phenol 10% can be carbolic acid, which can be useful for cauterization also. Chemical cauterization. All these are MCQs which can help you a lot of marks in your exams. Okay, what else are we supposed to look for? Generally, when I use for chemical agents, we can also think of halides, which are referred to as X minus. X is the common letter for all the halogens: chloride, bromide, fluoride, iodide. All of them can introduce free radical changes, and the free radicals can be destructive for the microbes. Next, you can use heavy metals. What exactly heavy metals you think of? Mercury, lead, arsenic. What are they intending to do? These heavy metals can break or interfere with the disulfide linkages. They can interfere with the disulfide linkages. For example, if this is a protein and there is another protein, in these proteins, between this area and this area, there is a disulfide bond, and this disulfide bond is important for maintaining either the secondary structure or the tertiary structure. And if the heavy metal like lead comes and sits in this area, they can disturb this particular disulfide bond. So the secondary structure can be altered or the tertiary structure can be altered. The protein can be rendered biologically inert. Protein becomes biologically inert. And when the protein becomes biologically inert, that is referred to as denaturation of proteins. So this denaturation can be induced in a microbe, and the microbe, though it may be alive, it does not have proper kind of proteins to propagate its action. Or if those proteins were vital proteins for the survival of the microbe, and if these proteins have been denatured, the microbe may not be able to survive. That is again capable of killing the microbe. So these are all the methods by which I can actually attack a microbe. So once again, ethylene oxide gas, formaldehyde, glutaraldehyde, aldehydes, and ethanol and isopropyl alcohol in case of alcohols, phenol as a corrosive agents, halogens, heavy metals. Sometimes you can think of dyes. Dyes, 90% of them are amino compounds, and 90% of amino compounds can act as dyes. The alternative corollary is also true. So all these things can be helpful as chemical agents. So when we speak about sterilization by heat, what are the things we have to notice? See, sterilization by heat only has one common mechanism. Heat will be able to destroy the secondary, tertiary, or quaternary structure because the proteins can have enzymatic action, and that enzymatic action is labile for heat. So heat labile property can be utilized, and that heat can cause protein denaturation. It can cause oxidative damage also, through which an organism can be killed. Remember, the heat is able to alter the electrolyte activity also. What are the different types of dry heat I can go for? Let me give you important things that can help you for your MCQs. In case of dry heat, what are the things we talk about? In dry heat, we have a concept called as flaming. We also have a concept called as incineration. For example, if I use a Bunsen burner and a small flame comes outside, and if I show any kind of loop or a metal structure in that area, even like a spatula, the flaming is enough to kill most of the organisms. And that can be helpful for wire loop and case of tip of forceps. While incineration means ability of you to produce ash. That incineration can be done for any kind of animal carcasses, dead raw meat material of an animal. Also, it can be helpful for burning the contaminated clothes. And your plastic, any plastic container which is contaminated, all of them can be incinerated. It can lead to ash. Next, we can think about the most important dry heat mechanism called as hot air oven. This oven can be run at different temperatures. For example, if I use 160 degrees Celsius for 2 hours, I can use it for 170 degrees at just 1 hour. What is this following principle as? Previously I told you in case of pasteurization, we had Holder method and flash method. If I increase the temperature beyond what is required, the amount of time of contact required can come down dramatically, I told you. A mere increase in 10 degrees Celsius was able to bring down the amount of time required by half. If I increase by 180 degrees Celsius, just by 10 degrees Celsius, I can bring down the time required to be 30 minutes. This is the beauty of any kind of holding time when it comes to increase in temperature. And what are the things you have to know? Hot air oven will not have penetrative power. No penetrative power. And if at all I try to apply heat of 160, 170, 180 degrees Celsius, then those materials who are liable to heat, for example, rubber gloves or rubber materials, will start melting on the spot. So I will not be able to use them for these kind of heat liable substances. Also remember, you can use the hot air oven by proper control mechanisms. You can have precision control mechanisms using certain kinds of Clostridium tetani, Bacillus subtilis niger. These two organisms can be taken from non-toxigenic strains. And I will try to throw in the spores of these organisms onto the surface of the material that I want to go for sterilization. Now, after subjecting them to this kind of hot air oven activity, if these spores are destroyed, which are extremely heat stable, if they are destroyed, it is understood that the other organisms or any other pathogenic organisms can be easily destroyed also. So, please remember these two structures, the spores of Clostridium tetani and spores of Bacillus subtilis niger subspecies, can be acting as a control for your sterilization, that is by hot air oven by dry heat. If I focus on the moist heat and I compare that with that of the dry heat, there is a lot of difference. Why? Moist heat will be having the water converting itself into steam. Steam has higher penetrating power. Why am I telling you this? Because you will be learning this particular simple concept in physics when you are in school itself. 100 degrees Celsius is the boiling point of water. When at 100 degrees Celsius, if water splashes on your face, situation number 1, at 100 degrees Celsius, steam splashes on your face, this is situation number 2. Which situation is worse? Steam is worse than that of water. Steam and water both can be found at 100 degrees Celsius, but the steam will be extremely corrosive and dangerous because it can destroy because of its penetrative power, which is not high in case of liquids, but it is present in case of gaseous state. So the ultimate goal of your dry heat versus moist heat is that to know in case of moist heat, the moisture can evaporate, the moisture can become gas, it can have more penetrative power than that of dry heat. Okay. So what are the things that you have to know in case of moist heat activity? See, when you go for moist heat activity, you can have two important conditions where you can have a temperature at less than 100 degrees Celsius of moist heat, or you can have conditions of 100 degrees Celsius for moist heat. So these are the two things I would want you to remember. Temperature less than 100, temperature around 100 degrees Celsius. In case of your mechanism, when I ask you, the sterilization by moist heat also undergoes the same mechanism as protein denaturation and coagulation. Coagulation of proteins will be the same as degradation of proteins or denaturation of proteins at a higher level. Okay, temperature less than 100 degrees Celsius can be seen in case of pasteurization of milk. Pasteurization of milk. Here is the place where we come under Holder method of 63 degrees Celsius for 30 minutes. Flash method 72 degrees Celsius for 15 seconds. Also, when you perform flash method, you can instantly cool it down to 13 degrees Celsius or even lower also. Please remember one thing. Holder method, when done for milk, will not be effective against Coxiella burnetii. Not effective against Coxiella burnetii. That raises the question, what kind of organisms can spread through unpasteurized milk? Coxiella burnetii, Mycobacterium bovis, your Campylobacter jejuni, and Brucella abortus. 4 major organisms who can spread through unpasteurized milk. So pasteurization of milk, if it is going through Holder method of 63 degrees Celsius or 60 degrees Celsius for 30 minutes, will not be effective against Coxiella burnetii. So I can go for flash method. 72 degrees Celsius for a few seconds, like 15 seconds. This flash method can be helpful for destroying Mycobacteria, Salmonella, Brucella. And remember, you will be requiring 63 degrees Celsius for 60 minutes if you want to destroy Staphylococcus aureus or Enterococcus faecalis, because they are more tougher organisms. So in case of staph or in case of enterococci, you have to maintain 63 or approximate degrees for 1 hour if you want to have an effect on these organisms. And remember, whenever you want to speak about most resistant spore, the answer would be Clostridium botulinum spore. Clostridium botulinum spore is the most resistant to heat. Most resistant to heat. So these are the organisms that you have to know before you go for your exams. What are the things that you know about Clostridium botulinum? If you want to destroy Clostridium botulinum, you have to maintain a temperature of 120 degrees Celsius for more than 4 minutes. And if at all this particular temperature and time has been reached, then the Clostridium spore itself has been destroyed. There is a guarantee that other organisms also can be killed. Also remember, when we speak about the moist heat, apart from pasteurization of milk, you can also think about the temperature being maintained at 100 degrees Celsius for killing an organism. What are the things that you have to know? Before we try to learn about 100 degrees Celsius per se, there is one method of moist heat activity, but it is less than 100 degrees Celsius. What is that method? It is referred to as inspissation. Inspissation. And the instrument I use will be called as inspissator. This inspissator can be helpful for sterilizing media, sterilizing culture media. What are the most common culture media that we discuss with inspissation and sterilize them? LJ medium for MTB, Loeffler's medium for Corynebacterium diphtheriae. They are sterilized by heating at 80 to 85 degrees for half an hour, which is approximately the same as, you can go for approximately half an hour, 30 minutes, and you do it on 3 consecutive days. Today I heat it to 80 to 85 degrees Celsius and then cool it. Tomorrow also I do it. Day after tomorrow also I do it. So do it on 3 consecutive days. That is the key word to differentiate this concept as inspissation compared to all the other kind of moist heat methods. So now we can go for moist heat that is applied at 100 degrees Celsius later. Now here I can go for 3 methods. One can be boiling. The second is called as Tenderization. The third is Autoclaving. 3 methods applied in case of moist heat at a temperature around 100 degrees Celsius. Okay, what about boiling? You're using the same old concept. Using water, you try to boil it, and when the water is actually boiling at 100 degrees Celsius, the penetrative power will be slightly lower than that of steam, but definitely effective enough to kill a microbe. What is tenderization? This is also referred to as intermittent sterilization. Intermittent sterilization. What will happen here? In this area, you are going to use steam, but you maintain 1 atmospheric pressure. And this is generally done for media containing sugar, gelatin, etc. because you do not want them to be completely destroyed. At the same time, you do not want them to be left infected. Also remember, you can go for 100 degrees Celsius for 20 minutes on 3 successive days. Now this is the area where many students have confusion. What is the difference ultimately between inspissation and your tenderization? Remember, tenderization is maintaining the temperature at 100 degrees Celsius and that is done for 20 minutes. But if it is inspissation, it is 80 to 85 degrees Celsius for 30 minutes, half an hour. Remember, when the temperature increases, the duration of exposure can decrease dramatically. So if I think about inspissation, it comes under the classification of sterilization by moist heat at temperature less than 100 degrees. If I'm going for 100 degrees, then I can go for just 20 minutes. In both inspissation and tenderization, I'll be doing it for 3 consecutive days. It means the same. This is also done for culture media. And what is the difference here? There, the culture media required in inspissation was for LJ medium in MTB and Loeffler's serum slope in case of Corynebacterium diphtheriae. Here, the culture medium can be generally done for those which are made up of sugars and gelatin. The third and the final one can be autoclaving. Here I can look for autoclaving at 3 different temperatures. One is 121 degrees for 15 minutes. The other will be 126 degrees for 10 minutes. And the third will be 134 degrees for just 3 minutes. Here, the difference is that in all the other areas we use steam. Moist means where we are trying to use steam or water vapor. Here, I am going to have steam plus that of pressure. Steam plus pressure. So now you have to fix the pressure also. Here, the most beautiful part is when I go for steam along with pressure, the penetrative power has dramatically increased. High levels of penetrative power. And the control you are using would be the spores of Bacillus, or some people say Geobacillus stearothermophilus. I hope you will be able to remember this for your exams. So once again, let's repeat. In case of autoclaving, the marker will be Geobacillus stearothermophilus. In case of dry heat or in case of ethylene oxide, it can be Bacillus subtilis. In case of ionizing radiation, this was not told to you, just remember, in case of ionizing radiation, the control will be the spores of Bacillus pumilus. Spores of Bacillus pumilus, or even the bacteria themselves, not even spores. For ionizing radiations, you can go for Bacillus pumilus. Okay, so now I'll give you a small gist of all the other kind of disinfectants we are using. See, let me give you a quick recap of all the disinfectants. First, we speak about alcohol. The alcohol is a very effective dehydrating agent. But the most important problem with alcohol is no effect on spores. But they can be virucidal and they can be bactericidal. And please remember, there is no difference between 90% alcohol and 100% alcohol. Just because I call it as 100% alcohol, it does not mean it is having high levels of disinfection. And please remember, among the alcohol, the one alcohol who is known for attacking fungal spores will be methanol. Fungal spores, methanol. As I've already told you, please remember, fungal spore is not meant for toughness, it is meant for reproduction. So killing by methanol is not a big deal for this particular activity. Now, in case of aldehydes, we have two different types of aldehydes, I told you, right? One is formaldehyde, the other one is glutaraldehyde. Remember, formaldehyde can be bactericidal, sporicidal, virucidal. All three can be present. And the same aldehyde, if it is going for, one minute, this is formaldehyde. If you try to draw glutaraldehyde, then this can be effective against tuberculous bacilli. Obviously, it will do what formaldehyde also can do. Tuberculous bacilli, fungi, and viruses. They can be taken into consideration. And what do halogens do? Halogens are capable of acting as fungicidal, bactericidal, and sometimes it can be your virucidal activity. Please remember, if at all a bacterium is floating around with spores, if there is a bacterium is seen along with spores, then if I expose the bacteria to the spores along with that of iodine, then iodine can be lethal to them. Generally, halogens are lethal to bacteria, viruses, spores, and the bacteria who are carrying the spores. Remember, whenever iodine is not able to show penetration, you will be adding something to the iodine. For example, iodine plus povidone is referred to as povidone iodine. Simple words, you call them as betadine. This is iodine and this is the carrier. Carriers are also referred to as phores. So iodophore compound is povidone. So iodine is the halogen. When they both are pent together, they can have high penetrability with which they can be helpful. And when it comes to radiation, you can divide them into ionizing and non-ionizing radiation. The ionizing ones are X-rays, gamma rays, and cosmic rays. Please remember, this is a very important mistake, rookie mistake done by many students. When I speak about radiation-induced sterilization or disinfection, we divide them into ionizing radiation and non-ionizing radiation. If it is non-ionizing radiation, it is UV rays or infrared rays. But when I speak about your ionizing radiation, we have gamma rays, we have X-rays, which are beta particles. They all can be penetrative because of the ions, and these ions will have the equal function of sterilization. So you call them as cold sterilization. The same amount of effect, it can be done in the presence of heat also. In the absence of heat, they are able to compensate for the heat itself. So now, what are the other kind of drugs which can be helpful in the vapor phase? For example, among the following, we can think of ethylene oxide gas and formaldehyde gas, beta-propanolactone. All of them can be acting in the vapor phase. And the most common thing that I would want you to take home for the exams would be, who are all sporicidal. I hope this will definitely help you. Mark my words, these are all the sporicidal agents. First is O3, which is ozone. Next, we can think about formaldehyde and glutaraldehyde. I told you glutaraldehyde is at a higher level than that of formaldehyde. It will do whatever that formaldehyde can do, an excess, sporicidal, fungicidal, etc. Also remember, the halogens can be sporicidal. I told you the halogens, the iodine can destroy the microbe along with that of the spore. Next, you can have ethylene oxide. Ethylene oxide gas also can be sporicidal. Now, this is one area where MCQs are abundantly available. The next area can be prions. Prions deactivation is a very, very important topic. Remember, if I start with autoclaving for prions, I cannot do it at 120 degrees Celsius, 121 degrees Celsius, 126 degrees Celsius, 134 degrees Celsius. Nothing works. So you have to raise the autoclaving's bar extremely higher. You have to maintain the temperature at 250 degrees Fahrenheit, not just Celsius, 2 degrees Fahrenheit. Okay. So 2 degrees Fahrenheit plus that of NaOH done for 1 hour. NaOH is a very strong base. Remember, NaOH is corrosive. It is as corrosive as acid. It is even worse than sulfuric acid. Autoclaving, 250 degrees Fahrenheit at NaOH along with NaOH for 1 hour. Next, I can do it for phenol. Phenol, 90%. 10% phenol is carbolic acid. 90% phenol doesn't have a name. That is capable of acting against prion. Along with phenol, your household bleach, the bleaching powder that is containing sodium hypochlorite salt, which can liberate ultimately HOCl dot minus radical. The hypochlorous radical is the one that helps you activate, and there is something called as sodium dodecyl sulfate. This sodium dodecyl sulfate will be 10% concentration, and this can be acted as a very strong detergent. And if at all I'm going to use the prions with that of formaldehyde, formaldehyde will not be effective. At the same time, urea, not effective. Ethanol, not effective. Boiling, not effective. Deoxycholate, not effective. All these are less effective. Okay, so this is needed for you to crack open certain kind of options. So let's revise once again. In case of prion, the first thought process that comes to my mind would be autoclaving, where I'm using the services of NaOH for 1 hour. Phenol, 90% concentration, not 10%. And HOCl means it can come from your household bleach or sodium hypochlorite solution. Sodium dodecyl sulfate detergent. Apart from them, you can go for simple incineration. Incineration, as I told you, is important for ash formation. Here I'll be using 900 degrees Fahrenheit for 1 hour. Because here I'm using NaOH, I have brought down the required temperature to 250 degrees Fahrenheit. So all these are important for your MCQs in the exams. So never make a mess out of this. You have to know this to get your right answers forward. Because this is my humble opinion. Please make sure you work on these. You revise these as many times as possible. You'll definitely get a question from this topic because these are practically utilizable form of microbiology. It is useful for not just a microbiologist, for all surgeons, consultants, and even people who are related to laboratory. And in case of patient care, all of them will be taking your services and this knowledge. So on that basis, please remember it as much as possible. Okay. Finally, in this particular topic, we can come for understanding the testing of efficiency. We can try to test the efficiency of disinfectants. Now, there are many kinds of testing of disinfections. The ones that are very old and not used nowadays would be Kelsey, Psychias test. Sorry for spelling. Psychias test. Apart from that, you can use phenol coefficient testing. Phenol coefficient tests. Because phenol is a corrosive, it can corrode through and through. You are trying to use that as a standard for understanding your disinfection. Now, the phenol coefficient test can be of two major types. The one that we always learnt in college would be your Chick-Martin test. Very old name that we have come across. Chick-Martin test. The other stylish name will be Riedel-Walker test. Riedel-Walker test. So what about Chick-Martin test that you have to know? This Chick-Martin test will be acting in the presence of fungi. In the presence of fungi, in the presence of feces, or in the presence of organic matter. Chick-Martin test will try to look at the efficiency of disinfectant in the presence of fungi, feces, or organic material. And remember, this particular, any disinfectant for the matter, say for example, X is the name of the disinfectant, and I'll look for the disinfectant's efficiency in going for disinfection using when there is a fungus or a fecal material or organic material. This particular disinfectant should be able to overcome that particular organic material and still cause disinfection. And this will be on comparison with phenol. What am I saying as phenol coefficient? See, in biochemistry, you'll come across a reference protein called as egg albumin. Whenever you try to take any kind of food substance, and in that, if you want to understand the content of protein, you'll compare the content of protein in that food substance with the content of protein in albumin. Why? Because albumin is present abundantly in the egg, so you can actually express the other proteins protein content or the other food's protein content as a proportion or as a percentile of the egg protein. Likewise, phenol is taken as a standard in coefficient activity, so the disinfectant will be compared to the efficiency of phenol. The same thing can be done in case of Riedel-Walker test. You're trying to compare the performance of any disinfectant with that of phenol, and this is done in case of a special organism called as Salmonella typhi. Here, I am not bothered about organic material being used or not used. You can use them or not use them. Here, in case Chick-Martin, you're trying to test the efficiency in the presence of organic material. The other kind of test you can do would be your surfactant killing test, surface disinfection test. You can be surface time kill test. If you expose a particular disinfectant on the surface of a bacteria or a microbe, the amount of time taken for that to go for complete killing will be called as surface time kill test. All these things can be used in your understanding. Now, the last portion of your topic in case of sterilization and disinfection would be about Spalding's classification. Spalding's classification. Let me not bore you much. Let me tell you the gist of it. See, those kind of instruments who will be touching my shirt or my chest, for example, stethoscope, will be not required for heavy disinfection, because even if I'm exposed to a contaminated stethoscope, I will not die a terrible death because the skin is enough to protect my integrity. But if at all there is an instrument who's placed inside the mucous material or travels to the mucosa, for example, thermometer placed inside the oral cavity, thermometer placed inside the rectal mucosa, they can be at a higher risk than that of a stethoscope being used. At the same time, if I use a EEG electrode or a ECG electrode, they are placed on the intact skin, they are of low risk. While laryngoscope and bronchoscope traveling through the mucosal area of the tract, they can be at a higher risk. But highest risk is what? Those instruments who are cutting through my muscles, entering into the blood vessels, entering to the bone marrow area. All these things require higher level of disinfection. So think about it. You divide all these items into non-critical items. For example, stethoscope. They require mild disinfection. They require mild disinfection or low level of disinfection. Here I can make do with that of alcohol, iodophores, phenol, which can come under moderate, and quaternary ammonium compounds, which come under low level disinfection, which comes under mild attack on the organisms. Also remember, these quaternary ammonium compounds can actually have a role to play only in vegetative bacteria, lipids, and viruses. When I speak about, there is stethoscope, BP cuff, or EEG electrodes, bedpans, etc., they all come under non-critical items. If I go slightly deeper, then I go for semi-critical items. Bronchoscope, laryngoscope, etc. come under semi-critical. At that area, I require high-level disinfection. I can require high-level disinfection, at least moderate level disinfection. The moderate level disinfection, I told you, alcohol, phenol, iodophores, etc. When it comes to high level disinfection, you have to go for glutaraldehyde and hydrogen peroxide. Now, when you want to go for semi-critical methods, and if you want to go for high-level disinfection, please remember a large number of spores may not be destroyed. Very small number of spores may be attacked, but large number of spores will not be handled by high-level disinfection. For that, you require a higher level called as sterilization. So that brings us to the items called as critical items. Those critical items who can deal with your blood vessels and can enter into your tissues, which can increase the risk of systemic infection, they require high-level disinfection as minimum and sterilization as maximum. Sterilization may require autoclaving methods. They may require ethylene oxide. Remember, ethylene oxide comes under sterilization. Do not miss out on this. And you can go for hydrogen peroxide gas plus that of plasma. These can be used for critical items. So the most common question that have been raised would be your level of classification in Spalding, that is coming for the items first place. You divide the items into critical, semi-critical, non-critical, and the levels of disinfection like low level, moderate level, high level, and sterilization. I repeat, in case of low level, you can go for quaternary ammonium substance compounds, like for example, even Dettol and chlorhexidine. You can go for mild level disinfection with the help of your alcohol, iodophores, and phenol. Moderate level disinfection is alcohol, iodophore, and phenol. Your high level disinfection can be glutaraldehyde and hydrogen peroxide. Please remember, sterilization comes for autoclaving, your ethylene oxide, your hydrogen peroxide, your plasma. Remember, plasma sterilization is a new method of sterilization for heat-sensitive articles. When will you speak about plasma again and again and again? When we speak about heat-sensitive articles. Heat-sensitive articles. Okay. Now, there have been certain questions raised about the purification of air, which is called as HEPA filters. High efficiency particulate arrestants. The key words are HE, of course, you'll be remembering. High efficiency particulate arrestants. They are capable of arresting the particles from moving forward. And how do they do? These are important. These are critical. These kind of filters have been notified everywhere in China. And in China, they are kept in public places. They are called as air filtering towers. But the HEPA can be used inside the home also. These can be helpful for preventing the spread of airborne contaminants. Airborne contaminants, which can be bacteria, viruses, sometimes rarely fungi and protozoa. Also remember, these kind of quality they can actually prevent the spread of 99.97% of particles, and those particles of approximately 300 nanometers to 3000 nanometers. Okay, so the minimum can be 300 nanometers, but can maximally go up to 3000 nanometers also. So make sure you remember this for your exams. With this topic, you will be completely strong in going forward for your exams. So never miss a single particular statement that I have told you in this particular topic. Every single word in this topic means a lot. And almost remember, modification of proteins is the most common method by which I can go for sterilization and disinfection as the mechanism. So in simple words, think about it. When you want to disinfect a clinical thermometer and stethoscope, the best way to move forward is isopropyl alcohol. If you want to go for fumigation of operation theaters, remember, operation theaters, you can go for formaldehyde. That is what is called as formaldehyde fumigation. Sometimes you can use beta-propiolactone also. When you want to go for endoscopes, corrugated rubber materials, in those areas, glutaraldehyde. Remember, endoscopes, 2% glutaraldehyde has been a part of many an MCQ session. Apart from that, you can look for arthroscopes and you can look for erythroscopes. There you can go for plasma sterilization. I just now told you plasma sterilization is done for heat sensitive articles. And if it comes to vaccines, because right now COVID vaccination has become very serious and they are gaining more importance. So they speak about bacterial or viral vaccines. Or if you're looking for serum or agar sterilization, in all these areas, you can go for seeds filters. Generally, when I want to vaccinate and then if I want to sterilize the vaccination or I want to make the decontamination happens, seeds filters can be used. Filtration, a biological and a physical method that can be used. And if it's a heat labile culture media, go for tenderization. Tenderization is temperature of 100 degrees Celsius. If it's less than 100 degrees Celsius, around 80 to 85, what is the time method called as? Excellent. Inspissation. Okay. If it's a disposable medical equipment like rubber gloves or if I'm going for catheters, etc., the best method to move forward would be ionizing radiation. I'll write it here. Disposable medical equipments may require ionizing radiation. Very commonly asked MCQs. For example, they have asked, before a surgeon goes into operation theatre, what is the most common agent they use? It is obviously povidone iodine betadine solution, and that will come under iodophore kinds of methods. And if at all there is small spills of blood, large spills of blood, spilling of blood. Remember, in any kind of operation theatre or in the laboratory, spillage is to be taken as a very serious biological hazard. Why? Because every single biological specimen of any patient should be taken with utmost caution. So whenever I'm going for small spills of blood, you can go for sodium hypochlorite. The same thing can be done for large spills of blood also. If sodium hypochlorite availability as a strong chemical is not there, then you can go for household bleach to deal with the larger areas. And the most important one I want you to understand is, if I want to preserve the vaccine, not for decontaminating the vaccine, if you want to preserve the vaccine, the preservatives used can be thimerosal, and there is an alternative called as thiomersal. These two are distinctly available compounds. Many people think that thimerosal can be a spelling mistake of thiomersal. Some people think thiomersal can be the spelling mistake of thimerosal. Thimerosal, thiomersal, both are compounds and they can be acting as preservatives in case of vaccine. With this, I hope you should be able to answer all your questions related to sterilization and disinfection. All the very best.